Greetings and welcome to Cybersecurity Today. I'm your host, Jim Wiggins. If this is your first time tuning into our program, allow me a few moments to introduce what we're all about. So what exactly is Cybersecurity Today? Well, it's a show engineered to explore the realm of computer security in a stimulating and insightful way. Cybersecurity Today is a half-hour broadcast utilizing a talk show news bulletin format to discuss themes, issues, and contemporary events in the cybersecurity arena. Our mission with this program is to dispel the murkiness and complexity often associated with the cybersecurity field. For our viewers who are already active professionals in this sector, this show will deliver a pulse on the current state of affairs. We feature a variety of esteemed guests to delve into topics that hold significant relevance to the cybersecurity landscape. Our objective is to offer information to a diverse audience, from beginners to industry veterans and everyone in between. You're sure to gain fresh and insightful commentary into the cybersecurity market. All right, so let's set the stage and discuss the structure of the show. This will help you understand what's in store. Today's show is divided into two parts. Our first segment, known as Cyber Bites, encapsulates several current events unfolding in the cybersecurity sector. Some of these developments might be familiar, while others may be entirely new to you. Moving on into our second segment, we're honored to welcome Ms. Ruchi Shewaramani, a Chief Information Security Officer in the healthcare industry that is primarily in the public sector arena. In today's discussion, Ms. Shewaramani will delve into the intricacies of navigating IT security and compliance in the healthcare sector, offering invaluable insights drawn from her extensive expertise. Whether you're interested in the latest compliance strategies or seeking guidance on securing healthcare IT systems, this session promises to be both enlightening and impactful. We're excited for you to join us in exploring the evolving challenges and solutions in healthcare IT security. Okay, so let's get into the Cyber Bites and talk about what's going on today in the cybersecurity industry. In current news, Apple is advising all iPhone users to promptly update to iOS 18 to mitigate a significant security flaw that could allow unauthorized access to personal data, including photos and location information. The vulnerability identified in the Transparency, Consent, and Control TCC subsystem enables malicious applications to bypass user consent protocols, potentially compromising sensitive information without detection. Cybersecurity experts emphasize the importance of installing the latest update to ensure device security and protect user privacy. In other news, in a concerted international effort, law enforcement agencies from 40 countries collaborated in Operation Hachi 5, leading to the arrest of more than 5,500 individuals involved in cyber-enabled financial crimes. The operation, conducted between July and November 2024, targeted various fraudulent activities including voice phishing, romance scams, and business email compromise, culminating in the seizure of over $400 million in illicit assets. This initiative underscores the critical importance of global cooperation in combating the pervasive threat of cybercrime. Those are some of the most prominent headlines currently shaping the cybersecurity industry. We're going to take a quick break, but stay tuned. When we return, we'll be joined by Ms. Ruchi Shewaramani, a Chief Information Security Officer in the healthcare industry, to explore critical strategies and best practices for navigating healthcare, IT security, and compliance. We'll see you back here in just a few minutes.
Losing weight's a lot harder than gaining it, but with every step, I lower my risk for type 2 diabetes and heart disease, and that makes every step very much worth the effort.
Learn how you can help stop diabetes. Visit checkupamerica.org or call 1-800-DIABETES.
Welcome back to Cybersecurity Today. Does your organization grapple with the complex challenges of securing sensitive healthcare systems while ensuring compliance with federal and industry regulations? Are you seeking expert insights to navigate the evolving landscape of healthcare IT security? To help shed light on these critical issues, we're thrilled to welcome Ms. Ruchi Shewaramani to the show. Ruchi is the Chief Information Security Officer in a healthcare industry, bringing over 15 years of experience in IT security, governance, risk, and compliance across the healthcare, education, and finance sectors. She has played a pivotal role in building enterprise security programs that comply with frameworks such as NIST 853, HIPAA, and FISMA, and has successfully led numerous federal security audits. With her extensive expertise, Ruchi will help us explore strategies to secure healthcare IT systems, meet compliance requirements, and protect sensitive information in today's challenging cybersecurity landscape. Ruchi, welcome to the show.
Thank you for having me, Jim.
Absolutely. We're super excited to have you here. So Ruchi, I wanted to ask you specifically about how the industry has evolved relative to IT security, and what are some of the more critical issues that organizations face today? Any thoughts?
Well, healthcare cybersecurity, if you've seen the FBI Internet Crime Report 2023, healthcare is the #1 target of cybersecurity attacks, ransomware attacks. So, and if you were to just look at this year's news with United, Ascension, healthcare seems to be the top target for ransomware.
Yeah, so I wanted to ask about that. So how do healthcare organizations protect against ransomware? What are some of the processes and practices that are kind of best practice in that space?
Sure. My recommendation as a CISO and having experience in healthcare primarily over 20 years is you have to invest in your protective, proactive controls as much as you are investing in your detection controls. And then last but not the least is you have to invest your time and effort and money into response and recovery controls in order to ensure your healthcare operations are fully resilient to attacks such as ransomware.
Understood. I know that in the security market, there's a lot of focus on frameworks. Yeah. I'm curious how, like for example, HIPAA, NIST 853, how do those basically influence the kind of protections that healthcare organizations implement?
Absolutely. So there's NIST 853, there's HIPAA for the health exchanges, health coalitions, there's CMS, MARZ, there's IRS 1075. I think all of these compliance frameworks play a key role in being the guideline, the North Star, and laying the foundation building blocks of all IT security programs. And
how do organizations, like what kind of challenges do they face when they try to align to these frameworks?
That's a very good question, because the language that these compliance guidelines use, it's very control focused versus the implementation is very technology focused. So there has to be a synergy between risk and technology, understanding of these controls and implementing them correctly.
So Ruchi, I know you've been involved in audits from a compliance perspective at certain federal agencies. Can you speak a little bit about the kind of things that you saw, or the kind of experience, or the kind of best practices that you would articulate relative to those kinds of experiences?
Absolutely. I've been very lucky to have been part of IRS, CMS, NDA, numerous federal audits, and also been fortunate to have cleared them successfully. My biggest recommendation for passing these audits successfully is just like going to the games, right? You can only win the game if you've done the legwork leading up to it. So I highly recommend working with professionals who either have experience doing these audits before, as well as preparing for the audit. The auditors are evolving. During COVID, the audit was done differently. We've had remote audits. We've had hybrid audits with partly remote and partly on-site. And each one of these federal audits is also run differently. For example, IRS audit always run on 2 tracks, versus the SSA audit or CMS audit runs sequentially. So if you have prior experience, it works wonders. Even if you don't, I would always recommend doing a mock run with all the key stakeholders, including your security and risk team, to make sure you're fully prepared for the day.
Understood, understood. So I want to build on a discussion both in terms of the compliance and the frameworks. For a lot of organizations, I assume in the healthcare industry, one of the outcomes or focus areas is building a security program. What do you see as some of the key elements that go into building an effective security program within the healthcare sector? Any thoughts?
That's a great question, given that there is a huge shortage of cybersecurity talent of 4 million jobs globally, 750,000 just within the US. One of the biggest challenge is to staff your cybersecurity team. Personally, it has taken me a couple of years to build a fully staffed, robust security team. So one is you got to have your people. Second, you got to have the technology. You have to have the softwares you need for all the security measures, security controls, data loss prevention, your threat management, vulnerability management. There is a basic toolkit that the security team need in order to be functional. And last but not the least, you have to have processes around the people who are using your latest and greatest technology, and establishing that process, communicating it, and effectively and efficiently using them is also time consuming, but very important for a robust security program.
So I want to build on something that you just kind of talked about, and that was the people side of the equation. Yeah. How do you try to integrate or ensure appropriate collaborations between the business leaders, between the subject matter experts, between the auditors, between the regulators, when we think about the strategy and trying to make sure that that program itself is really meeting organizational requirements?
Again, security is top priority for security department, but it is not necessarily the top priority for IT as a whole, or business operations, or Office of Strategy and Planning. The key component there that I find very helpful in building that synergy and collaboration between the teams is not just telling them what to do and how to do, but it's also spending time and efforts in quantifying the risk and telling them the why behind it, as to why they need to do certain security things, what is the risk behind not doing it. And then another hard lesson learned, having done security for many years, is it's also very important for the security team and security leaders to understand the why of the other teams, as to why they cannot immediately patch what we have just found. So the why communication both ways is very good in terms of synergy.
Understood, understood. Let's build a little bit on top of the people side of the equation. One of the key elements of dealing with people is identity and access management. I'm curious as what are some of the best practices when it comes to dealing with people and identity and access control do you see are really useful in the healthcare space? Anything in particular?
Absolutely. ACIA speaking, the compliance framework, these are one of the top controls within our compliance regulations, and also in terms of controlling who has access to your systems. Access control, that is where your identity access management platform comes into the picture, your password policies, who is navigating to what application and retrieving what data. That all comes under role-based access control, privileged access control. And if as a security team, you do not have complete insights and you're not auditing, monitoring, controlling it, that's going to be a big blind spot. Because if you do not know who's in your system, for how long, doing what, how are you going to immediately or effectively detect and respond to a cyber incident? So I think identity access management is, again, a very critical component of security.
Understood. So we've talked about a little bit about the people side of it.
Yeah.
Let's talk about technology for a moment. There's a lot of emerging technology that's coming out there. For example, artificial intelligence, machine learning. What particular role do you think these technologies play in strengthening the cybersecurity of healthcare environments?
Again, I think very good call out. AI, generative AI is a top topic for all the organizations right now. I think it's a double-edged sword. In one way, artificial intelligence is making it very easy for uh, greater number of people to be able to come up with more sophisticated attacks for less amount of money. So it's posing greater threats in terms of cybersecurity. As well, the other way around, there are cybersecurity tools that can now leverage AI to be able to better respond. So I think we look at AI from both the perspectives.
That makes sense. That makes sense. So we think of AI as kind of an automation mechanism. It's able to kind of automate kind of things you were talking about, whether it's the attack or the defense. Are there other aspects of automation within the healthcare sector that you find automation kind of streamlining or helping kind of strengthen or help assist those organizations?
Absolutely. There's only enough people in the workforce and vacancies. As much as we can automate, I think there's huge benefits to it. There are specific tools that I'm looking at. Mostly, we talked about the synergy between risk and security. There are tools that are automating some of the work that are done manually by the compliance teams in collecting all the artifacts and generating these humongous reports. Some of the security plans are like 500 plus page documents. So if we can leverage and automate some of this paperwork or collecting of artifacts, have tools that are tied into your cloud posture security management, it really brings in efficiency to our regulatory compliance work and makes it very real time.
So, you discussed the role of automation and some of the different tools. Are there any other specific practices or processes or tools that you think are useful or helpful in the healthcare space that can help improve cybersecurity collectively for the organization?
There are so many tools. I don't think there's a scarcity of tools. It's just investing correctly in, like I said, the protective, detective, and response tools and education and awareness for those tools.
Understood. Let's talk now about from the organization's perspective. Let's talk about culture for a minute. What are some of the things that you see are useful approaches or methods to kind of build a kind of a security conscious culture from the workforce's perspective? Any thoughts?
I think that is critical for an organization's success of cybersecurity measures, because if the security team is operating in a silo, all it's going to take is one user that clicks on the phishing link. So the cybersecurity mindset is 100% key to the success of the security teams.
Are there specific training programs that you've rolled out or seen to be relatively effective in trying to help kind of influence those behavioral conditions that you're talking about?
Absolutely. I think that 1 hour long annual security awareness training does not hit the mark. So we've started looking at the concept of microlearning, where you spend just 10 minutes, hit on one topic, it's informational, and not taking 1 hour of their time where they're just clicking away stuff. So I would absolutely say microlearnings and more frequent learnings is the way to go in making sure that our staff is developing that cybersecurity mindset throughout.
Understood. Okay, so we've talked about the people, we've talked about some of the technologies. Let's now talk a little bit about third parties. I assume that in the healthcare space, there's lots of third parties that healthcare providers have to communicate with and integrate with. How do you ensure that those third-party vendors are complying with the security and the compliance requirements of a given organization?
Again, I think healthcare is very unique because of the third parties. The attack surface of healthcare just keeps on evolving and increasing, and it's very important that we are not just securing ourselves, but we are also holding our third parties to the highest standards of cybersecurity for our organization. One thing that I have personally found very effective in doing so is it all starts with the contracts and agreements. As part of our procurement life cycle, we ensure that we are combing through the contract and adding the relevant security as well as compliance language to each one of the third-party vendor. Again, we cannot have a one-size-fits-all for all, but we make sure that if one third party is going to deal with federal tax information, that they have the applicable security requirements. So I would start with building it into their contracts and agreements.
Got it. Okay, that makes a lot of sense. I ask every guest that comes in to kind of look into their crystal ball, look into the future.
Yeah.
How do you see, the trends and like maybe your predictions for how things are going to evolve in the healthcare space over the next 5 years? Any thoughts on that?
So looking into the crystal ball and already starting to see how the industry is turning, especially given how close attacks on United and Ascension hit the patients directly, the impact of ransomware on the lives of patients who we serve in the healthcare industry, I definitely see a trend towards resilience. All the organizations putting in more investments in disaster recovery, in their continuity of operations and planning, and their resilience.
Understood. Talk to me about stress management. How do you manage the stress associated? It seems like healthcare is always in the news relating to one particular cyber breach or another. Any guidance on how, for aspiring cybersecurity professionals, how they would actually go about maybe trying to deal with that kind of those kind of conditions?
Again, this was also a theme at Gartner this year. Stress management is key because we are operating in a very high pressure environment. My personal recommendation is find an activity where you are able to disconnect. For some people it's running, for some people it could be meditation, and in my case, I try to run or go to the gym because in that 1 hour, my brain is disconnected. And I feel your brain recharges and you're able to manage your stress much better. And then I also know if I'm running and I'm thinking about a work problem, that's a big problem. Then I have to go back and address it.
Understood. I don't have it on the question list for you, but what are some of the actual resources that you use to try to stay current relative to, healthcare and IT security? Anything in particular you like to look at, websites or any particular type of resources?
I think just staying ahead of all the cybersecurity news. When I'm not working, I am always reading, whether it's LinkedIn or the certain security websites, but I'm always tuned into what's happening currently in the cybersecurity, what can we do in staying resilient with it. So my one word would be constant awareness. That's what we preach to our staff, right? As the constant education and awareness. So that's what I implement for myself.
So that kind of leads me into my next question. You've got somebody that comes to you, they're an aspiring cybersecurity professional, they want to concentrate or focus in healthcare IT. What are your recommendations? What should they do? Should they get certifications? Should they go back to school? Should they get an internship? What are your thoughts?
So my first thing to them would be, most of the people think cybersecurity is pen testing. Cybersecurity is not just pen testing. It's not just hacking or breaking systems. Cybersecurity has different flavors. Like we talked about identity access management. We talked about governance, risk, and compliance. There are different departments in cybersecurity teams, and not every department needs extremely skilled pen testing or ethical hacking mindset. So my biggest advice to students who are trying to break into cybersecurity is do not pull yourself back thinking that there is a very high threshold to get into the cybersecurity industry. And I think it's a two-way street. We as the recruiting people or the hiring staff in the industry also have to make sure that we are not creating a barrier that does not allow students to be able to enter the cybersecurity industry.
What are examples of barriers? Are they requiring certain, in the job description, certain certifications?
It's like if you have a posting for a junior security engineer and you're going to start with 5 years of experience, and if every job in the security team starts with a minimum 5-year, 2-year experience, you are inherently not allowing the students to come in. So you have to make sure that your recruitment works with interns. There is a way that you're hiring interns from the schools, and then you are investing in them to retain them on your teams.
Understood.
And that was the work we also did. Otherwise, there's only enough skilled talent in the industry to be able to fill 750,000 vacancies that are already out there. We have to build the pipeline of bringing students in.
Kind of building on that, I was just kind of curious, what kind of abilities do you think an ideal candidate has in cybersecurity and healthcare IT? Critical thinking, communication, like think of the soft skills. What are the soft skills that you think are in most demand? You talked about a lot of the technical stuff.
Yeah.
We spent a lot of time on technical, but maybe talk about the soft skill stuff.
Soft skill, again, is not very much talked about when we think about the cybersecurity industry, but it is a very important skill to be able to articulate the risk, to be able to articulate the vulnerability, to be able to articulate what's happening in the moment of an incident. I would say overall, communication skills is very key for cybersecurity industry. Also, critical thinking or analytical thinking of piecing things together to be able to think what's really happening behind the scenes. We do not always have the fanciest tools telling us there is an incident in this place at that time. So you have to be able to analyze information and piece it together.
Understood. Last question for you. How could viewers of the show reach out to you or contact you if they had follow-on questions?
Great question. I can leave my email address. I'm also, I guess, specific for students. I am the board member for ISACA GWDC, serving the academic institutions in Greater Washington, D.C. So I can share my academics at ISACA email for the students to be in touch.
Awesome, awesome. We'll put that on the lower third, and we'll maybe put a link for it. So, Ruchi, we want to appreciate you coming in. Great having you on the show, and thank you so much for sharing your information.
Thank you for having me.
That wraps up today's episode. We extend our heartfelt thanks to Ms. Ruchi Shewaramani for sharing her invaluable expertise on healthcare IT security and compliance. Her insights into securing critical systems and navigating complex regulatory landscapes has been truly enlightening. We hope that today's discussion has provided you with actionable strategies and a deeper understanding of the challenges and solutions in healthcare cybersecurity. For more information about cybersecurity today and to stay informed about future episodes, please visit our show's website at www.cybersecuritytoday.org. Additionally, you can scan the QR code displayed at the bottom of your screen for quick and easy access to our show's website. Finally, we welcome your questions or comments via email at contactus@cybersecuritytoday.org. Feel free to reach out to us. We're here to assist and engage with you. That does it for today. Thanks a lot for joining us. We look forward to seeing you at our next broadcast. Stay safe and stay informed. Have a great day.